Hey, everybody, welcome back to the summit. I'm here with somebody who's going to give you a perspective on postpartum exercise that you probably haven't heard before. She's very practical, very inspiring. So, even if you're not a mom yet, tuck this information away because you're going to want to know it. So, I'd love to introduce you to Beverley Simpson. She has all sorts of ideas for you and things to consider when returning to exercise postpartum. So, hi.
Hi. First of all, I just want to say thank you so much for having me here with you on the show and being part of the summit. This is stuff that I'm so passionate about and I love talking about it. So I'm super excited to be here with you and just thank you so much.
Oh, thank you for being with us. So, ladies, we are going to pick Beverly's brain and hear all sorts of wisdom today. So, I want to start with just one question that is absolutely burning for me as somebody who doesn't have any children yet, but is hopefully on the cusp of having some children. Can you tell me what are some of the things we should know about the difference between exercise before baby and exercise postpartum? Like what's going on down there?
Yeah, sure, great. So this is an this is an awesome question, and honestly, I'm so glad that you asked because the truth is, when I think about me and just a little bit about my experience and my past, as someone who went from being a super fit trainer to
Yeah.
then going through a transformation of pregnancy and then going through that postpartum experience, I was really adamant
Yeah.
about acting as if I wasn't pregnant. And I was running, I was a fitness manager for this a big box gym in Manhattan, and I was working primarily with men. And this is not a story about them; they're amazing. The men in
Yeah.
my life are amazing,
Yeah.
but it was about me in the sense that I was wanting to run with the boys. I was wanting to keep up, and even
Right.
though I had a certification in postpartum training, it wasn't really something that I was burning to learn about or burning to know because it really didn't apply to me
Yeah.
at the right. And then it was and so during those pregnancy and during those transformations, I felt like I just would just close the door to Dr.
Mm-hmm.
Google, because it was advice that I had heard, don't
Uh-huh.
Google. But I just took it to the nth degree. I literally went into my pregnancy and my birth knowing absolutely zero about what to expect,
Oh
about the
boy.
changes that were going to happen to my body, and then about, what was going to happen really in that first year postpartum life as a mom and as a working mom,
Yeah.
and as a working mom who relies on the on my body and brain,
Yeah.
right? So for me, the things that people typically hear a lot when it comes to working out and training when you're pregnant is just listen to your body,
Yeah. Good advice
right?
always.
Which I hear that, right? And it is good advice, but the thing is, and a little bit about what I was me personally was experience is just listen to your body kind of means nothing because when you're pregnant, this is a body you don't know.
Oh, that's a good
This,
point. Yeah.
this is a body you don't know yet. You're learning it. And especially for athletic moms. And
Mm-hmm.
to me, if you're working out consistently, you're an athlete and
Yeah.
you have an athletic mindset. And we're used to pushing through pain.
Right.
We're used to going to our upper limits of what our threshold is, and then beyond that,
Right.
right? And when you're pregnant, I'm always encouraging my moms to really think about, and this is something that came from one of my mentors, Brie Battles, who talks about the risk versus the reward.
Mm-hmm.
You always want to ask yourself when you're doing any type of movement during pregnancy, is the risk worth it? Is it, really digging into why do I want to do this,
Right.
right? And that is not to say that movement and exercise when you're pregnant is bad. It is absolutely not. The benefits for exercise is just, uh, I mean, I could speak for a whole hour on just what those benefits
Oh yeah,
are.
you're in good company in this group here.
Yeah, right. So it's not that, I definitely don't want to, and I also want to emphasize that moms and pregnant moms and postpartum moms, we're resilient and
Mhm.
we're designed to go through this experience. So I don't want to necessarily scare you into movement or to thinking, right? It's that spectrum of variability is what I
Right.
talk about. Is that you just want to make sure that you have enough awareness and mindfulness to ask yourself these questions and to continue pregnancy and returning to exercise postpartum the safest and most efficient way possible,
Yeah.
right? And I definitely always want to help my moms, when I'm especially asking them the risk to reward,
Mhm.
to remind them that pregnancy is a season. And you have the rest of your
Yes.
life to be super fit, right?
Yeah.
But that year pregnant or 40 weeks that you're pregnant versus and tagged on to that year postpartum, it's a
Yeah.
season. And to remind them, especially when they're early postpartum, that you have the rest of your life to be fit, and this time is it's a limited resource, and it's never coming back. So I encourage them and hope that they can stay grateful and present in in these moments, because that newborn time that you get with the baby, you never get back. And there are definitely moments when you're like, thank God those aren't coming back. But for the most part, I definitely don't want my moms to look back and think, man, I was obsessing over getting my body back,
Yeah.
instead of spending time with, those treasured moments. So that's one of the things I would say that you hear a lot is just listen to your body when you're pregnant, right? And then you hear that age-old myth about your heart rate. You don't want to get your heart rate up too high, right? That's just a myth. And ACOG, they have tried to debunk it a million times.
Yeah.
But it's one of those things.
But it's out there, and it's not going anywhere.
That's a myth, right? And then also to remind moms too that, and this is true for not just moms, but for women in general, is to remember that exercise and that nutrition is an individual process.
Yes.
Right?
Absolutely.
And there's no one size fits all. It's not like what works for Sally and Betty is not necessarily going to work for you, and that our metabolism is uniquely individual, and that the way that our body, depending on our fitness level, like it's all just very specific, and you have to kind of become this detective on yourself, on your own personal metabolic detective and your own personal exercise detective. And that so what's moderately intense for you is going to be different than what it is for your friends. You just have to learn that, and that just takes a little bit of time, and also being around a coach that knows.
Yes.
Right?
Extremely important.
Yeah, for sure, right? So that, that's definitely one of the things, and then what's happening in pregnancy when, aside from, so as the uterus is growing, right, the front of, so your the way that your core functions and fires off is just completely changes. Because you've got the rectus abdominals that are in the front. I call them the sexy abs. They're the ones that everyone talks about. They're made in the kitchen, right? So they're inserted into what is called this connective tissue, which is called the linea alba, which runs from the top of the sternum all the way down to the pubic bone, right? And so what happens as the uterus grows is that it's stretching, completely stretching, and it's basically the way that you stabilize and support your spine, it changes. Babies are growing, organs are moving, not to mention the fact that your blood volume is increasing and that your cardiovascular system is impacted. Like, tons of things are completely changing. Now, again, that's not to say that you can't move. And that's not even to say
but it's just different.
It's just different. Yeah. You just need to, be mindful of it and know what that means for your body. So, for me, I was super fit when I was going into my pregnancy, but I had a miserable pregnancy. I still had sciatica flare up. I still gained 45 pounds. I still, I had trouble moving. Even though I worked out through my pregnancy, I think that a lot, especially in the fitness industry, aside from, I think I always also remind the coaches that I'm surrounded by
Mhm.
is that we're in this tiny little bubble. But the
Oh, yeah.
majority
It's a
of the
weird bubble too.
yeah, and the majority of the fitness world talks about, they use marketing
Yeah.
strategies and tactics and language that to pry on moms or
Hmm.
prey on moms' fears. I'm thinking like, oh, I
Which
need
is
to.
so wrong.
I
That's
know. You know,
it's a season,
we're
like you
working on
said.
changing.
We gotta
Yeah,
love that. We gotta appreciate it.
yeah, for sure. We're working on changing it, but it's hard, and I know for me too. When I talk about my personal experience,
Mhm.
which I've shared a lot,
Yeah.
is that children and really how I got here. My kids got me to this place where it forced me to face decades of body hate, right? And
Oh, amen.
it forced me to face decades of body hate,
Yeah.
and which is such a gift that I'm so grateful for now,
Mhm. Yes.
right? Because now I can help other women go through the same things, right? But so that's part of part of that language and things that they're looking for, that's just because we're all kind of caught in that hamster wheel,
Yeah.
essentially. So a lot of marketers will scare moms into thinking, oh, because I really wanted a vaginal birth, which I called a natural birth at the time,
Hmm.
but really wanted a vaginal birth, and I thought that if I worked out, that I would
Yeah.
get that my recovery would be easier, that I wanted to breastfeed because I felt like if I breastfeed, I would lose
Yep.
all the baby weight, right? Which isn't the case for every
Uh,
person, which I
no.
now know.
No.
You
And
know,
your best laid plans, right?
Right, right. And I'm sharing that now after, all that
It's
work that
right.
I've gone through because at the time, I didn't know that or think that.
Right.
Right. It's just now I've realized as I'm here now and also working with moms that this
Hmm.
is where that is the mantras I had to change in my
Yeah.
brain and in my mind.
Well, all we hear is, you know, all these things you're supposed to do as a mother. And then, I mean, it's just an extension of all the things that women are told we're supposed to do. You're
Oh,
supposed to be hot in your 20s. You're
yeah.
supposed to get your baby body back. I mean, like pre baby
Yeah.
body back. Every magazine you see is a celebrity with their pre baby body back. And, those are things we hear in life. I mean, I remember I worked as a trainer at a big box gym and, a great gym too, where people that came, clients were smart, they were very savvy, a lot of them, science based people. I had so many people come in with these things that are just expectations. So many women who had just had babies or it had been a year, and the desperation to get back to what they used to be instead of appreciating what they are now
Mhm.
was a hard mindset shift to help them make.
Oh, for sure. And that is still hard and
Yeah.
still, that goes too, for lots of old athletes who
Hmm.
I used to talk to lots of
Yeah.
people who used to tell me that they wanted to get back to their high school weight or high school body. And I'm
Yeah.
like,
You were
whoa,
a
but
child then.
you
You were
were
under
really
18.
kidding. The work is just honoring, where you are in your body now. Right.
Yeah, exactly.
And it doesn't mean, and this is something too that I've worked with, and this is primarily the moms that I work with, is that doesn't mean you can't have goals, and it doesn't even mean that you
Right.
can't have physical goals, right? You can want to have a physique change. I get it, right?
Yeah.
You might have a whole bunch of clothing that you want to get into, but it has to come from a place of knowing that your body is great now.
Yeah.
So I often ask my, moms at first when we're starting off is, if nothing changed, would you be okay?
Yeah.
And
And
if the answer to that
that's
is no, then we got to do a little bit of, like,
exactly.
let's just figure
Yeah.
out why their mind isn't like that. That's what the work is, right? But that's,
Yeah.
that is mindset stuff, right? So that is, something I would say too for my moms that are pregnant. And then also, there's this huge, especially in the CrossFit community and
Hmm.
the strong first community, because I live there. I live
Yeah.
in the kettlebell community, right? Is that there is this almost pressure, and it's not pressure from the group. I would say I think that everything is different, but it's
Yeah.
from that athletic nature in itself to
Yeah.
keep up with, as a trainer,
Yes. Yes.
pregnant, you have this pressure that no one's putting on you necessarily, except
Right.
for your athletic heart, right? That to keep up and do the same
Mm-hmm.
weight that they were doing before, or that they're not at 80%, but they're at 70%,
Right.
right? So it's just, so I was starting to talk about, what's happening to the body. So in addition to the core function, right? So your pelvic floor, when I talk about the core, I'm talking about your pelvic floor,
Yeah.
I'm talking about your transverse abdominals, the rectus abdominals that are in the front, but I'm also talking about your diaphragm, right?
Yeah.
So it's like this canister, and all of these muscles work together in concert.
Yeah.
Right, and so that whole pressure system is essentially is changing when you're pregnant, right?
Yeah.
And so exercises that I'm definitely mindful of for my moms is whose bodies are changing, is that you necessarily don't need to put so much pressure on your pelvic floor with overhead stuff, with standing all the time, because there's going to be a lot of weight on that pelvic floor, right?
Sure.
This is also for my moms that have had cesarean births, is they think, oh, maybe I don't need to worry about my pelvic floor because I didn't deliver vaginally.
But that was major
true.
surgery.
Well, it is a major surgery, but for 40 weeks you had this growing
Yeah.
baby that was putting, pressure on that pelvic floor, right?
Exactly.
Yeah, so that is definitely, something I want to remind my moms and who are pregnant, so that you're making sure that and that to remind them that we don't push through pain, and this is true for postpartum moms too, right?
Yeah.
We don't push through pain.
Yes.
And that,
good tip.
Yeah, right. And that also, and this is true for pregnant moms and also for postpartum moms, right? So let's talk. I talked a lot about pregnancy, but I'll move into the postpartum chapter.
Yeah. Right? I mean, this is, what you had said about, we're talking about a season that's up to a year after having a child. So this is a significant part of your life that, I mean, your body is changing. Your body is seriously in flux for this entire time period.
Yes.
Sometimes women lose a little sense of self once, everything's about a baby. Of course, that's how we operate. And trying to find your way back to yourself physically and mentally seems extremely hard to me. I cannot speak to it yet, but it seems like a major challenge to me.
I mean, it is, right? It is, it is, right? And so I just want to go, and I said this earlier, but it's super important, especially for moms that might not necessarily be moms yet, but are considering it. I just want you to remember that we are resilient, and that we are designed to do this, and that it will be okay, and that in the grand scheme of things, whether it's 1 year or even 3 years, because it depends on the mom and how long it really takes you to kind of just. And when I say, I don't mean get your body back in terms of looks or anything, but I just mean a sense of stepping into yourself again. Because you spend a year growing a human, and then you spend a year, whether you I'm a fed as best person, but whether you choose to formula feed or whether you choose to breastfeed, you're still, your body belongs to this little baby.
Oh yeah, your sleep hours, your fun hours, everything's with this baby, and we tend to minimize that as women. I mean, as women, we take on a lot, period. That's not to say our men friends don't too, because they do. But it's different for women because you are often, especially in those early months, years, your primary caretaker. Even if the baby doesn't depend on you for food necessarily, you're very much part of that baby. And I love your philosophy of just, you need to get back to you, period. And then maybe your body, but find your way back to, your own sense of self.
And for me, and for a lot of moms that I work with, part of that was introducing exercise. So when I think of self-care, right, self-care for me 100% is exercise.
Oh, yeah.
It clears my brain. It just helps so many things, right? So for me, I did have an urgency, at least the second time. The first time around, if I'm being honest with you and completely transparent, I had this urgency because I had married my self-worth with body image, and I didn't believe that I could be an effective coach if I wasn't that mom holding the baby 3 months postpartum with my six pack. Right.
Amen to the rest of us speakers
Right.
in this summit, because as a fitness professional and a health professional, sometimes you don't want to admit that you fall into those behaviors. And
Oh
full
my gosh,
disclosure, I just had a brownie for lunch. So we're real people
right.
too.
Right, and I have worked with hundreds of trainers as a fitness manager, as a district fitness manager, who have confessed the same things, where they feel like they are not an effective coach because of their body image, right?
Yeah,
and they feel like they don't have a six pack, and I'm like, but girl, take a look at your genes. There's a whole bunch of stuff that is at play here when it comes to a six pack, and a six pack doesn't make you a good coach.
And that's
right?
one version of a good body. That's
and that's a subjective.
Exactly.
That is 100% subjective beauty standards that are 9 times out of 10 not defined by you.
Oh, exactly.
Right? Yeah. And it's defined by Photoshop, because Photoshopping is an amazing tool.
It's a freaking miracle if you understand it's Photoshop.
Right. And I am saying that a little bit with sarcasm, clearly, because I am not a Photoshop person, but like that, you can't, like, that is that's what people are comparing their real life bodies to these non-real life things, right? Images, and that's coaches, moms alike, right?
So we're all victims of it. Even men are victims of that.
Oh yeah, men too. Men too, for sure. People are. Yeah, it's this vicious cycle that we're just in, and that we're working on changing.
I mean, it's worse for us, but men do go through it. It's that whole idea of manufactured reality, which is cool and interesting, and it's an art form in itself, but versus reality, and trying to find that understanding of you can aspire to be something, but maybe you're not going to have a six pack even if you never have a child and you live in the gym.
Yeah, for sure. 100%.
It might not happen.
So for my postpartum moms, right, so here are some of the things that I'm going to say this, it's controversial a little bit, but the 6-week checkup where you get that green light, it's like 6 to 8 weeks depending on your type of birth you've had. It's not necessarily the green light everyone says it is, right?
Tell me more.
Yeah, okay, right?
Okay, yeah, now I'm intrigued.
Right? And here's why, right? And it has nothing to do with the doctors necessarily. But we get cleared at my 6-week appointment, and I think that this is partly because my doctor knew me. This was my second. Yeah. She knew I was a trainer. She knew I was educated in this. Yeah. She walks into the room and clears me 100% for running, jumping, anything I want to do, and she didn't even do an internal exam yet, right? Wow. And I'm thinking to myself, I just had a cesarean birth is a major surgery.
Yeah, it is.
People get ACL tears, right? And they have, I've never had one, so I can't speak to it. Like, they get referrals for physical training or for PT, rehab. They have to, do all these things, and you're over here having a cesarean birth, and they're like, okay, bye, peace, to go do all those things, right? And I know that part of that is because we're, again, designed to do it, right? And the ACLs aren't normal. Yeah. But it's still, the pregnancy and giving birth is vaginal or cesarean has a huge impact on the body.
That's traumatic for your body.
Makes a huge impact on the body, right? So, and then the reason why I say that it's not a green light, really, in truth, is because that not all of these mommy boot camp classes that people go into are created equal.
Right.
And I'm saying this in love because I have been there. And I have been one of those trainers that thought I was educated.
Yeah.
Because I had this cert. Yeah. Right? When in truth, I had, no idea what I was doing. And thank God, my poor moms that have worked with me, I love them, and thank God that they're fine, right? But
yeah.
When I look back on what I know, what I know now versus then, I think, oh man. And of course, I was still smart enough to know that moms brand new their first workout, they were not jumping up and down necessarily, or because, again, it goes back to, it depends, and it goes back to, mom's fitness levels and all those stuff.
Mhm.
It's not a one size fits all, but I definitely know and what the warning signs are. So here I've done a talk on for my trainers that, things that, because things like red flags, things to keep in mind,
Yeah.
because the truth of the matter, and this is a phrase coined by Brie too, which is that oftentimes trainers and workout classes, group fitness instructors,
Mhm.
we're the first line of defense,
Yeah.
because moms don't know that they're looking for this information, or they think that it's normal and they think they have to live with it when they don't
Mhm.
have to.
Yeah.
And so sometimes they will confide in their trainer before they even talk to their doctor, because they don't know to ask their doctor.
Right, and they
Right?
sometimes they can't really put it into words either.
Yeah. And I mean, here's an example, right? And this is something I just saw from Scary Mommy the other day, which yeah, it just is that we joke about peeing in our pants,
Yeah.
right? Okay.
Right.
That is something moms do not have to live with. Do you know how many moms I've worked with that there are 2 to 3 years postpartum and they're still leaking in their pants, and they think that that's normal because,
They've heard
we
it. Yeah.
they've heard it,
Yeah.
and they're like, oh, that's just what happens to me now when I'm pregnant, when that is actually not true. You do not
Yeah.
need to live your life, peeing with incontinence, right?
Right.
That is something that moms think, but they don't talk to their doctor about it because they think it's normal,
Yeah.
right? So that is definitely one of the things I have my trainers listen for and ask: like,
Yeah.
are they having urgency when they are rushing? When they're
Right.
back to working out, are they rushing to go to the bathroom? Otherwise, they're going to pee in the pants in that moment.
Right.
Do they leak sometimes in a compromised positions like squats, deadlifts?
Yeah.
Are you seeing? Are they complaining about low back pain consistently? Because that could be a form of diastasis, right?
Yeah.
Or even incontinence, right? It's all about you want to restore your pelvic floor and core
Right.
function, and which can be, there are things that you can do, like work on your alignment
Yeah.
and work on your breathing techniques, and you can do that day 2.
Yeah.
Right, day 2, you can start working on alignment and breathing.
Yeah.
You can start rehabbing rehabbing the functionality of the the core muscles, right?
Yeah.
So those are things. So incontinence, low back pain. You also, especially when you're when you're looking at a mom, really anybody, you want to think of every movement as an assessment. Right.
Right.
So take a look at their body. Do you see coning? So, is there like a little cone that's coming in between
Mhm.
between their abs? Right. You want to, and if you're skilled enough, you can, look into measuring a diastasis. You want to
Mhm.
look. You want to look for tension in the linea alba,
Yeah.
as well as the gap. It's both, right?
Now, is
You
this something that the women could do at home themselves
absolutely
too?
100%.
How could
100%.
they do that themselves? I mean, I want them to come to us as trainers too, and be open and talk to their doctors. But I'm sure people are thinking, and wondering
Do I
right
have
now,
one? Do I
do I
have
have
one?
that?
Right? Yeah,
What are
sure.
some ways that they could, obviously knowing they're not doctors or trainers, how could they assess some of that themselves?
Okay, great. So I definitely have, I definitely have videos, and there are tons of videos. Look
Yeah.
at resources like Girls Gone Strong, Jessie Mendel,
Right.
me, Bree Battles,
Yeah.
right? That talk about this, and we actually have videos on showing you how you can measure it, right?
That's awesome.
And there's a way that you start laying on your back, right?
Mhm.
You feet up, and you want to like in a floor bridge position, and what you want to do is you want to just tuck the chin gently, and I want you to, and I have my moms just lift their head. I don't want them to sit up. It's not a sit
Yeah.
up, but it's a gentle lift, right?
Right.
And there are 3 places I have them measure. It's usually 3 fingers, right
Mhm.
above where the pubic bone starts, 3 fingers above there, right below the belly button, and then in between the belly button and the sternum, right?
Yeah.
You want to measure, and you use your fingers, right? So what you're doing is get to that place. Like, so let's just pick the one right below the belly button, right? You're going to put your fingers in, tuck the chin. You're going to lift, and how many fingers does it take for the two big muscle bellies, the
Mm-hmm.
rectus abdominals, to meet. Like you'll feel them
Oh,
hug your fingers, right?
that's
And
easy
then,
to do.
and then you also want to make sure, like, you want to check the tension. Do you feel like you can just keep pressing all the way to the floor, right?
Yeah.
And you feel like, oh, I'm touching my spine? Or is there a little bit of like a trampoline feeling, sensation, right?
Right.
So, so those are the ways that you can measure it. And then we talk about ways, using your alignment and breathing to see the difference and feel the
Yeah.
difference. And then checking in when you're working out. Like, is your exercise exacerbating the
Mhm.
gap or tension? Is it not? And then, as always, whether you're a coach or a mom, always, always, always ask for help, right?
Yes.
There is no shame, right? And this is something that I have personally had to work through, but also, with the trainers that I have worked with, you do not need to be an amateur technician. You do not need to be someone who specializes in postnatal necessarily to work with moms. You just need to know. You just need to build a network of people that you can refer out. That, I think, people oftentimes feel a little bit intimidated to do that, because that they'll like the PT better, or they'll like that other person better, or that you aren't the one-stop shop. But clients will trust you more if you can actually help them get to their goal.
And those who are interested in personal training and all that, do make sure when you ask your trainers, just like Beverly's saying, they have a network of people, hopefully, or can refer you. So do ask.
Right? And there is no shame in referring out. You want to, and if you're new to the game and training, start digging into your network, finding out your client, start asking your clients if they've ever had PT and who their favorite PTs are. Get on the phone, go to offices. I've met with a ton of pelvic floor physical therapists, right? You want to start building that type of network and relationship so that you can work together, because the truth is, just as there are tons of trainers that are, because we're all human, right? And there are going to be trainers that are more educated in this. And the same is true for physical therapy. And a lot of OBGYNs and doctors, they might not necessarily know this stuff either, right? This is, we all have our specialization so that we can work together to help a person. All right. So there, I always encourage my clients to work with a PT, or if something's not working, like, I will refer out. There is nothing wrong with referring out, because levels of diastasis and prolapse and all these things, right? They are all and incontinence even, it is all dependent on the person, and that and the severity is different. Right. So sometimes these small tricks that we do know as trainers work. Sometimes they don't. And if they don't, we'll refer out. Right. So you want to make sure that you are working with someone, and that because I've worked with and heard from physical therapists that have told patients that they can't even walk up the hills in their hometown.
Wow.
Right. And you're like, wait a
second.
And then, or they, there are physical therapists that are, are used to working with athletic minded moms and women, but not, and some that aren't. So the ones that aren't, they don't understand that urgency, that desire, the need for self-care to move.
Exactly. And when I think of not only new moms, but really anybody who is training or seeking some type of medical or physical help, sometimes we get scared to ask questions. And the professionals do know a lot. We know a lot of stuff. But, there are other people who might know more. And sharing your information, being willing to ask questions, and having a healthy dose of skepticism and asking for different opinions it's something I've always encouraged my clients to do. And, like you're saying, there are some PTs who know more than others and might tell you can't walk up a hill. And another one would say, well, of course you can. I'll give you the exercises to figure it out.
Exactly. So it's all about just, finding out what works for you.
Exactly.
So I, definitely, and then I always remind my athletic moms, and I was saying this earlier, is you just want to make sure that you rest, give yourself permission to postpartum. You have tons of time, tons of time.
Yes.
Right. And then I often get asked a lot about breastfeeding and exercise and how, that's another big topic, which we could, talk about for another hour. But no, yes, moms can 100% exercise and not worry about their milk supply. It's all about, supply and demand and enough nutrients. Like that but it's mostly about supply and demand. And so exercise is okay for when you're breastfeeding. You don't have to stress on it.
See, that's good news too.
Yeah, right. And you just want to make sure that you're wearing a comfortable sports bra so that you're not, especially if you're worried about ducts getting inflamed or
things aren't real when you're pregnant, from what I've heard.
Yeah. And then, and that you just want to always be in tune with things that, might seem normal. Ask about them, just ask. Like, even things like, is sex uncomfortable?
Yeah.
When it's not supposed to be. Right? Yeah. Those are things that we don't think we can talk about or should talk about with our doctors, but 100% talk about it. Right.
And if you can't, don't take it with a grain of salt, but at least ask Google. A grain of salt. Well, if you have a question that's something that's bothering, if there is something physically bothering you, it's always worth asking the questions, because the doctor might say, "Oh yeah, that's totally normal."
Yeah, right, maybe, right, and then look for second opinions too.
Yeah. We have to be extremely active health consumers in everything, and luckily, we've started as professionals to start to shift toward that and encourage it. Mm-hmm. So I have one last burning question for you before we wrap up.
Okay.
You are a guru when it comes to mindset and fitness. And I want to know what you would say to somebody who has taken maybe a longer break than they thought they were going to from the gym. Let's say that waiting postpartum turned into 5 years. And they're starting to think they're lazy, which I'm going to put that in big, big quotes, lazy. How can we create a healthy mindset for fitness success when there's been a long break and you're starting to feel a little bit like it's a personal flaw?
Okay, that's a big question.
I know that's a big burning final question.
Yeah, no, I totally get it. And it's things I felt a lot, right? I think that if someone was coming to me with that, I definitely would work on trying to push through the all or nothing mentality.
I like that, yeah.
Because what happens is that typically what I've found is moms that have waited that long, athletic moms that we're used to have waited that long, is that they end up they're married to perfectionism. Right. And I think a lot of moms and a lot of women or people. I think
that's going to sound familiar to the crew out there.
Yeah. People in general, we are looking for the perfect time that we can overhaul everything, like our diets, our routine. We're all of a sudden going to go from 0 to 6 days a week. Right. We're going to do 40 minutes at the gym, right? So we're always looking for that, I call it the case of the Mondays. I'll start Monday.
Yeah, I was just thinking that.
I'll start Monday, right?
I'll start Monday.
I'll have to wait for this holiday or this vacation.
Right.
So typically when I hear that, right, or, so those are typically the things I hear from people that have waited a really long time. And if they come to me feeling like I'm scared, I feel lazy, then I'm going to start digging into like, what's the issue? Are you scared to go to the gym, right? Are you, what, or is it, are you married to perfectionism? Are you looking for the all or nothing, right? Thing, and I'll encourage moms to just do one small thing.
Yeah.
One small thing.
Take one walk.
Yeah.
That's it.
Take one walk. Right? we'll dig into like, well, what have you been doing now? And then just make
Yeah.
one small change, and that you start building those habits. Because, we
Yes.
didn't really we didn't talk about this yet, but what happens in our brain is so amazing and awful at the same time.
Yeah.
Because our brain is designed to protect us from pain. Right?
Right.
So we believe that when we start making a change, our brain is trying to protect you and jump in there and just be like, because they think like, literally your brain is telling your body, you are going to die.
Yeah. Yeah.
Right. And you're like, wait, no, I'm not. Right. So it's almost like you have to do these small changes to convince your brain that you're okay.
Yeah.
And your brain's like,
Absolutely.
I am someone who walks. I am someone who works out 2 times 30 minutes a week. And then I am someone who eats vegetables.
Yep.
Right? That's those. So taking action, and imperfect action, over and over and over, is what builds habits and what helps change the mantras and the stories that you're telling yourself consistently.
I love what you're saying about how this type of work can help you slowly, gradually realize you are the type of person who can do this. Because when you've taken a longer break and you sort of know you've taken a longer break than you should have, we have these stories we tell ourselves like, I'm so lazy, or I'm not really a gym goer anymore, or my favorite, I'm after 35, who even cares?
Right.
I've heard that.
And also, and one of the things that you said that I hear too all the time is that, moms will say exactly what you said. I should. Right? And I'm always working on taking out that word out of our language, because there is no should, right?
It doesn't help anything.
Do what you can, right?
Yeah.
It's not there. That word should is just designed to make us feel bad, right? It is, okay, this is what we're doing, right?
Yeah.
So there is no, I should, but sometimes I'll have them say, I want. Yes. Okay, great. So what can we do to make that happen? Right?
Absolutely.
So those, even like those types of language shifts are huge, and are huge for our subconscious, right? A lot of sometimes when I'm looking at posts or you're thinking about my posts, sometimes I'm like, this is just semantics. But the truth is that semantics matters to our subconscious, and that's who we're talking to.
And I think we should end on that, because that was a mic drop right there. I mean, we speak these things to an existence, and yes, absolutely.
Awesome.
Well, thank you so much for being here today.
Sure, my pleasure.
And everybody, I'm going to put some of those resources that Beverley talked about for doing some diagnostics on yourself. Those will be in the session notes as well.
Okay, great.
Thank you for coming.
Sure, no problem.